Welcome to Dr. Hayatu's medical session. Today, we will discuss peptic ulcer disease, a common condition that affects the digestive system. In this session, we'll explore the causes, symptoms, diagnosis, and treatment. Before we begin, don't forget to hit that subscribe button and ring the notification bell to stay updated on our health content. Let us start. Peptic ulcer disease, or PUD, is a condition characterized by the formation of open sores, known as ulcers, in the lining of the stomach, upper small intestine, or esophagus. Peptic ulcer disease can be classified into different types based on the location of the ulcers and the underlying causes. The most common types of peptic ulcer disease include gastric ulcers. These ulcers occur in the lining of the stomach. They are often associated with H. pylori infection. Duodenal ulcers. These ulcers occur in the lining of the duodenum, which is the first part of the small intestine. They are also commonly associated with H. pylori infection. Esophageal ulcers. These ulcers occur in the lining of the esophagus, which is the tube that carries food from the mouth to the stomach. They can be caused by factors such as acid reflux, alcohol consumption, and smoking, and can cause symptoms such as difficulty swallowing, chest pain, and heartburn. Stress ulcers. These ulcers occur in the lining of the stomach or duodenum and are typically caused by factors such as severe illness, injury, or surgery. NSAID-induced ulcers. These ulcers occur in the lining of the stomach or duodenum and are caused by the long-term use of non-steroidal anti-inflammatory drugs such as aspirin and ibuprofen. Zollinger-Ellison syndrome. This is a rare condition that causes the stomach to produce too much acid, leading to the formation of ulcers in the stomach and duodenum. It is caused by a tumor in the pancreas or duodenum that produces a hormone called gastrin, which stimulates the production of stomach acid. It's important to note that the symptoms of peptic ulcer disease can vary depending on the type of ulcer and its severity. Symptoms of peptic ulcer disease include abdominal pain, usually in the upper abdomen, nausea, vomiting, bloating, weight loss, bloody or black stools, and heartburn or indigestion. Diagnosis of peptic ulcer disease typically involves a combination of medical history, physical examination, and investigation. Modalities for peptic ulcer disease include stool tests. Stool tests can be used to check for the presence of H. pylori infection, or blood in the stool, which can be a sign of bleeding ulcers. Blood tests. Blood tests can be used to check for H. pylori infection or anemia, which can be associated with peptic ulcer disease. X-rays of the esophagus, stomach, and upper small intestine after swallowing a contrast material, barium. The contrast material helps to highlight any abnormalities in the lining of the digestive tract. This is a procedure that uses a thin, flexible tube with a camera, endoscope, to examine the lining of the esophagus, stomach, and upper small intestine. During the procedure, the doctor can take tissue samples, biopsies, to check for H. pylori infection or other abnormalities. Treatment for peptic ulcer disease depends on the underlying cause and severity of the condition. Common management options include antibiotics to treat H. pylori infection, proton pump inhibitors, PPIs, or histamine 2, H2, blockers to reduce stomach acid production, antacids to neutralize stomach acid, lifestyle changes, and surgery in severe cases. Peptic ulcer disease can lead to serious complications, such as bleeding, perforation, or obstruction of the stomach or small intestine, so prompt diagnosis and treatment are essential. In conclusion, peptic ulcer disease is a common condition that can cause a range of symptoms and complications. Early diagnosis and treatment are key to managing the condition and preventing complications. If you experience any symptoms of peptic ulcer disease, it's important to consult with a healthcare professional for proper evaluation and management. If you found this information helpful, subscribe for more health-related content. Thanks for joining us. And until next time, stay healthy.